Hi, everybody. Dr. Ellie Stein here with the video tip of the month for February 2025. Hopefully, this will get you as excited as it got me. It's called Could Virtual Reality Benefit People with Fibromyalgia? Now, in this video tip, I'm going to start with a quick review of FM, what it is, what it feels like, and I'm going to emphasize the role played by the brain. Then I'm going to introduce a new evidence-based treatment modality, virtual reality, which is grabbing attention. So, starting with the basics, what is fibromyalgia? It's a chronic syndrome consisting of musculoskeletal pain all over the body, fatigue, cognitive problems, unrefreshing sleep, and often accompanied by low mood, in other words, depression. At the biological level, fibromyalgia is characterized by something called nociplastic pain. Nociplastic pain is caused by neuroplasticity run amok. That's the plastic part of the word. The key feature in nociplastic pain and in fibromyalgia is altered pain processing in the brain and the spinal cord without evidence of tissue damage, inflammation, or nerve injury. Now, lest you find this statement dismissive of your suffering, let me assure you that FM pain is both real and measurable. Studies show evidence of changes in brain function, things like increased glutamate levels and altered electric function in the brain and spinal cord. Although that is true, it's also true that because fibromyalgia is generated by neuroplastic changes in the brain, neuroplasticity can be leveraged to reverse these changes. And a neuroplasticity-based approach is likely to be more effective for fibromyalgia and many other chronic pain syndromes than conventional medical approaches, which focus on the area of the body which hurts, right? So say if my leg hurts, it would be normal for me to think, oh, the pain must be coming from my leg. In fact, that's not the case. The pain is generated by the brain. What triggers fibromyalgia? The risk factors for developing chronic musculoskeletal pain, such as FM, includes anything that sends danger signals to the brain. Even signals from long ago injuries or traumas could ramp up pain processing in the present. So things like, first of all, probably the biggest trigger of fibromyalgia is other sources of pain. We call those peripheral pain generators. So I use the kind of saying to describe this that pain begets more pain. Chronic pain from things like arthritis or autoimmune diseases frequently leads to secondary fibromyalgia. Emotional trauma in childhood or adolescence is associated with fibromyalgia, the presence of depression, having had surgery, sleep impairment, and believe it or not, even the use of opioid medication can ramp up the pain processing in the brain and actually cause more pain. What does fibromyalgia feel like? How do you know if you have it? Chronic nociplastic pain conditions generated by the brain have different features. They feel different than when you have acute pain, like when you stub your toe, for example. So they usually include widespread pain, pain all over. Maybe you got an injury in one part of your body. Once fibromyalgia sets in, the whole body hurts, right? Not just the part of the body that was initially affected. It has an unusual feature that it often moves from place to place, so it's not always constant. It's often associated with increased sensitivity to light touch and things that shouldn't be painful. There's usually sensitivity to temperature. Typically, cold feels bad to people with FM. Almost always there's cognitive difficulties, problems with concentration, memory, and thinking clearly and quickly. Unrefreshing sleep is almost universal in people with FM. Sometimes there's the the feeling that maybe the pain is interfering with the sleep. Research shows that people with fibromyalgia, they're waking up or their sleep is getting less deep multiple times each night. It's often associated with depression and anxiety. And another unusual symptom, it's associated with loss of precision of fine movement. So people actually get clumsier. So now that we have a good understanding of fibromyalgia, I'm going to describe virtual reality and then the evidence of how it may be helpful. So virtual reality is defined as the use of computer modeling and simulation to enable a person to interact with an artificial environment. Now, this environment is usually a combination of visual. So you're seeing things usually through some kind of a headset. You're usually hearing things. There's usually headphones. And often the virtual reality system is asking you to make movements and it's monitoring your movements and giving you feedback. Now, virtual reality has many features which may enhance neuroplasticity. So many of the articles I read on VR are explaining that the reason they work is because they're helping us rewire our brain. So some of the features of VR are immersion. You're seeing, hearing, sometimes even feeling and moving in response to this artificial or virtual environment. If it's well designed, it can really grab people's attention and help them feel immersed and connected with that environment. If it's very engaging, it's going to help them stick with their daily practice protocol so that they can make progress faster. It's interactive. These virtual reality systems give you feedback in real time. How did you do with the exercise or action that was recommended? And often there's an imaginary component where you're encouraged to learn and develop new skills and ideas. Virtual reality stimulates measurable positive changes on brain imaging. So they've done studies with functional MRI, seeing which parts of the brain are lit up, and QEEG, and also transcranial magnetic stimulation. And on all of these, the changes on imaging, so the objective changes, correlate with subjective reports by the people in the study. So they're reporting that they're functioning better. And at the same time, the objective measures are kind of substantiating that. So what this suggests is that neuroplasticity is the driver of the functional improvement in using virtual reality, and it's not just a coincidence. Now, some of the benefits of virtual reality compared with usual treatment include the following. You know what? Rehab. Say you're trying to rehab from chronic pain and you've become quite disabled. Say you're trying to rehab from a stroke. Say you're suffering from anxiety or depression. Say you're rehabbing from something acute like a surgery. VR is used in all of these situations. Rehab can be tedious and boring. It takes a lot of determination and motivation to stick with it. So VR is being proposed as a tool that can help engage people and make it more fun. It's multisensory. As I mentioned, it's visual, auditory, and includes movement, and it activates many areas of the brain at the same time. This is great for neuroplasticity. The more alert and awake the brain is, the more it's paying attention, the more neurotransmitters are released um, that enable neuroplasticity to take place so that you can rewire your brain to have a different experience of life. VR is usually gamified. You're usually getting rewards like beautiful images or pleasant music, or you're given stars or fireworks go off when you get something right or when you're getting closer to your goal. So this is, again, engaging and helping people really commit to the practice. It has been measured that VR holds people's attention longer, probably due to this multisensory gamified environment. Um, Also, you get shown things, right? There's visual images and there's words and there's music. And so about 10% of people really struggle with neuroplasticity-based practice because they have a hard time imagining. And VR gives you some images and some things to focus on. So I think it may help some people who have difficulty imagining get across that hurdle and be able to practice. Because VR is something you can purchase and have in your home, it makes practice easier and less expensive than if you had to repeatedly go to visit a practitioner and pay a lot of money for appointments. Now, virtual reality has been used for some time in chronic pain, like probably as long as 20 years. And here's some example of what you might experience if you engaged with a VR system for chronic pain. You would be immersed in a calm, pleasing environment, often in nature, like being in a forest or being at a lake. You might hear birds chirping or water moving. You may be guided through meditations that will teach you things about pain. So there's usually an educational component. It may encourage you to shift some of your beliefs about pain and the cause of your suffering. There's usually some cognitive strategies and skills that are embedded in some of the teaching and meditation. And you're taught these while you're in a relaxed state, right? So often there's some meditation or paced breathing involved to get you in a really calm state so that you're more open to receiving the new information. And as you're progressing, you may be encouraged to gradually perform some actual tasks that currently trigger your pain. So, for example, physical movements. Taking action to do the things you want to achieve is really important. Thinking about it is not enough. You have to move into the action phase. So, a review of several studies in people with chronic pain who used daily VR practice showed that it effectively decreases pain and increases function compared to other strategies. And believe it or not, virtual reality rehab has been tested in fibromyalgia in particular, and it's been found to be quite successful. Taken together, studies for VR in FM, a lot of acronyms there, so virtual reality in fibromyalgia, show improvement in a wide range of symptoms, including pain ratings, balance, aerobic fitness, fatigue, quality of life, and anxiety and depression. Now, I asked ChatGPT, what does a virtual reality experience feel like for someone with chronic pain? And here's what it told me. It suggests that the immersive environment is so engaging that the pain fades into the background. It doesn't disappear, but there's a sense of detachment from it, as if the experience in the virtual environment kind of buffers your mind from your body. It stresses that relief isn't just physical, it's emotional. It may give you a rare moment of control over what usually feels overpowering. That it stresses that the technology doesn't cure the pain, but it retrains your brain to process it differently. This is an important point. Neuroplasticity-based practice doesn't take away the physical underpinnings of biological pain. So, for example, if I have arthritis, it's not going to take away the arthritis. But what neuroplasticity and potentially virtual reality systems will do is rewire your brain so that you process the pain differently. I call it turning down the volume on pain processing so that even though you still have the biological causes of the pain, say the arthritis, it won't bother you as much, and hopefully it won't hold you back from living the life that you want to live. Now, a question with any intervention that you probably want to be asking is whether it's safe. That's a great question because virtual reality you're just imagining things, right? It's not actually touching you or injecting anything into your body, for example, like medications. So in most studies, very few adverse effects are reported. The most common is a sense of motion sickness because if you're really immersed in this virtual environment and there's movement involved, that can be, I guess, unbalancing to the nervous system. So they call it cyber sickness. They actually have a name for it. So it includes feeling disoriented. If it's severe, you may have nausea, dizziness, sweating, and even loss of balance. And in the research studies, typically 1 or 2 people out of every 20 experience this to such a degree that they drop out of the study. What's usually recommended in this case is to decrease the intensity of the experience and the duration of the practice session. So start with the mildest stimulus, let your body get used to it, and then gradually work up. So back to my mantra that I talk about so often, which is baby steps. Now, a question that didn't come up in any of the papers I read, but I think is important, is that virtual reality systems are tech and they involve electricity and you're wearing stuff around your head, and there may be Wi-Fi or Bluetooth involved. For people that are electro-hypersensitive, this just may not work. There just may be too intense of an EMF environment, especially around the head, which is where most people are more sensitive. So my sense is that if you have electro-hypersensitivity, I would probably give this one a miss. Now, say I've whet your appetite and you're a little bit interested. How could you find a virtual reality system? It's not that easy. I spent quite a bit of time looking up different systems that were mentioned in research. Some of them have gone out of business. Some of them don't ever seem to have made it to kind of the commercial market. Some that I found were really expensive, like in the thousands of dollars. And a lot of these seemed like they were intended for professionals rather than patients or people with fibromyalgia. One of the papers I read made a really good practical advice. They said, identify the skills or the symptoms that you want help with. So, are you dealing with pain? Do you want to improve your thinking? Are you recovering from a stroke and you want to improve your mobility? Do you want to get more comfortable with activities of daily living? Do you want to improve your mood or your sense of calm? These are all quite different, and the systems or games that you might choose for each of these is going to be different. One paper said, you know what? How about go to a commercially available system, something like Meta's Quest series or Nintendo Wii? They have a wide variety of games, and you might be able to find some at a pretty reasonable price, usually a few $100s, to see if this could help you. So in conclusion, leveraging neuroplasticity, our brain's natural ability to change in response to lived experience, is increasingly being included in mainstream multimodal treatment packages for a wide range of conditions, including fibromyalgia and chronic pain. Virtual reality may be a way of enhancing people's ability to access and benefit from neuroplasticity-based practice due to the fact that it's more engaging, multisensory, and very immersive, and maybe for some people more fun. What I've found is, unfortunately, there's no clear leader in the field. It probably depends a little bit on the symptoms that you're hoping to get help with. And some research will be required by you to try to find a VR system that's right for you. If you're already using a VR system, I would love to hear from you. What are you using and what your experience has been? And if you happen to find one that looks intriguing, please let me know so I can pass the information on to others.